Hello, it's Dr. Evie Kemp here again with lesson 4, depression and anxiety in patients with comorbidities. So let's just have a look at our learning objectives. So we want to demonstrate the ability to manage depression and anxiety in patients with comorbidities, and we're particularly going to look at diabetes, cardiovascular disease, respiratory disease, and cancer. So let's just look at some definitions just to start with. Comorbidity. Comorbidity is the presence of one or more additional diseases or disorders occurring at the same time as a primary disease or disorder. Common mental disorders, that's basically depressive disorders and anxiety disorders, and severe mental disorders, we're talking about bipolar disease, schizophrenia, and other psychosis. And what we're going to do is to look in quite a lot of detail at this important WHO report from 2017, which was called Addressing Comorbidity Between Mental Disorders and Major Non-Communicable Diseases. And if we think about non-communicable diseases, there are very significant linkages between them and mental health disorders in both directions. So there are, as we know, major modifiable risk factors for non-communicable diseases. This is what lifestyle medicine is all about, isn't it? It's all about our diet, how active we are, whether we smoke, whether we drink, and whether we can manage our stress. And we know that many of those stressors are really exacerbated by poor mental health. It's very much a two-way situation. And I think it's important that we just think about the biopsychosocial model of all disease, but specifically about mental health. Now, the old model, really very old model now, was the medical model. And this was thinking about disease as a deviation from some sort of normal or measurable biological state. And the role of the doctor was to somehow treat and get you back to baseline. Well, now we know things are a lot more complex than that, don't we? And we know we've got to think about these three areas and how they interact together. So there's the biological side of this. So this is, the physical health, the genetic vulnerability, the effects of drugs, and so on. There's obviously our psychological well-being, our coping skills, our social skills, our self-esteem, and our attitudes and our beliefs towards sickness, incredibly important. And then there's the social and environmental side of this. So what are our family circumstances? What's our culture? What work do we do? What's our socio-economic status? And we know that all of these things come together, and our mental health is here in the middle. And if we want to treat mental health, we need to think of all of this together. So we know mental health impacts physical health. We were talking before about how stress causes a whole range of physical symptoms, the palpitations and the tummy upsets and the sore shoulders and the sore back and increased incidence of coughs and colds and so on. We also know that people with mental health problems often take significant medication that has side effects, and those side effects can include particularly things like the antipsychotics, weight gain. And that means that people with mental health problems really do have an increased vulnerability to a range of physical health conditions as well. But we must look the other way around, because physical health really impacts our mental health as well. And chronic physical conditions that can be associated with chronic pain and stress can certainly lead to anxiety and depression. And in the picture here, this is somebody with severe rheumatoid arthritis in their hands. You can see not only can this possibly be very painful, but it very much affects their function, and it leads to a degree of disability. And when people have got disability and they can't do things, particularly if somebody's hands are affected, they can become very isolated from social support systems. They may not be able to work. And in fact, the more symptomatic the chronic physical condition, the higher the incidence of mental health problems. And that can start a real cascade. So let's start at the top here with common risk factors. So common risk factors, we think about things like an unhealthy diet, physical inactivity, alcohol and tobacco intake, childhood adversity. All of those things can help to maybe increase the incidence, or at the same time, mental health conditions can occur. So the mental health conditions can aggravate the incidence of these non-communicable diseases and vice versa. And that has a real impact on one's ability to function, on one's ability to cope at work, on one's ability to manage at home, and that may lead to loss of one's work or early retirement, and certainly poor quality of life. If you can't work or you retire early, often you're in reduced economic circumstances, and at the same time you may have to spend more on healthcare, and you have more debts that mount up and savings go down. And at the end of this cascade, you're in a situation of potential poverty and inequality. So the more that we can actually try and prevent this type of cascade, the better it is for everybody. So let's look at diabetes as our first condition, and let's look at diabetes and common mental health disorders. So first of all, depression is actually 2 to 3 times commoner in people who are suffering from diabetes, and that's actually a higher incidence in women than men. And not surprisingly, if you've got depression, that's associated with poor glycemic control and higher levels of HbA1c. So if you're depressed, you're less likely to carefully look after yourself and your blood sugar. And as I just said, diabetes and common mental disorders, there is a significant association between depression and non-adherence to diabetic treatment. It's not really surprising. You don't feel great. You can't quite be bothered to do your blood sugars today. You can't quite be bothered, because you just don't feel up to it. You don't feel well enough to really concentrate on your diet. There's a very interesting meta-analysis of studies looking at microvascular complications of diabetes. So we're talking about diabetic eye disease, diabetic retinopathy, kidney disease, nephropathy, and diabetic neuropathy. And this meta-analysis showed that there was significantly more microvascular complications among patients who were also depressed. So it's really clear and important that people with diabetes should have regular checks to assess their depressive symptoms. What about diabetes and severe mental disorders? Well, diabetes is actually 2 to 3 times commoner in people with psychotic illness, such as schizophrenia or bipolar disorder, possibly because of the medication that they're taking that means that they put on weight, but not just because of that. And certainly people with diabetes plus a psychotic illness are more likely to die early than people with diabetes alone. So incredibly important, if you're looking after people with severe mental disorders, that you're really checking them for diabetes and making sure that if they are diabetic, that the diabetes is well controlled and they've got good diabetic care. And more than 70% of people with severe mental disorders smoke as well, and that significantly increases the risk for diabetic microvascular complications. And similarly, smoking increases the risk 14-fold for complications of diabetes. So we're talking about cardiovascular disease, kidney failure, blindness, erectile dysfunction, and so on. So let's go on to cardiovascular disease and mental health disorders. Well, depression and anxiety can predict the development of cardiovascular disease and worsen its prognosis. However, there is no evidence that screening for or treating depression and anxiety improves cardiovascular outcomes, such as preventing a myocardial infarction, for example. However, cardiovascular disease is the commonest cause of death among people with severe mental disorders. So therefore, identifying and managing all those modifiable risk factors for cardiovascular disease, things like smoking, weight, hypertension, diabetes, and so on, in people with severe mental disorder can reduce the risk for premature mortality. So again, it's really making sure that we're looking after the physical health of people with mental health disorders and trying to really reduce their risk and look at their lifestyle as well. What about chronic respiratory disease and mental health disorder? Well, interestingly, 1 in 3 cigarettes smoked is smoked by a person with a mental health disorder, and anxiety and depression are more common in people with respiratory conditions. Smoking is much more common, 70 to 80%, among people with severe mental health disorders than the general population, when it's only around 10 to 15%. And smoking, not surprisingly, worsens the outcomes of non-communicable diseases, particularly diabetes and cardiovascular disease. We know that. And therefore, providers of mental health care should really look at making their services smoke-free for both patients and for staff. So that's a no smoking on this hospital site sign, and to have ways of really helping their patients and the staff to give up smoking. And let's, last but not least, look at cancer and mental health disorder. Now, 25% of cancer patients suffer from anxiety and depression. This is an important quote I'd just like to read to you from a book called The Fault in Our Stars by John Green, where he wrote, "Whenever you read a cancer booklet or website or whatever, they always list depression among the side effects of cancer. But in fact, depression is not a side effect of cancer. Depression is a side effect of dying." And certainly palliative care, psychological assessment should be done whenever possible, and evidence-based psychological treatment can be extremely helpful. And there's another book I'd like to recommend to you called With the End in Mind by Dr. Catherine Mannix. Dr. Catherine Mannix is a palliative care consultant in the UK. She's written this wonderful book about palliative care and patients who she's looked after over the years. And she explains how she uses actually cognitive behaviour therapy in palliative care with great success. So just well worth going to try and get that book. Anyway, certainly cancer also may be more common in patients with psychosis, but it's likely to be due to lifestyle choices such as smoking more rather than any other reason. However, cancer and mental health disorder, people with severe mental health disorder are sadly less likely to access healthcare services. They're therefore likely to present at a much more advanced stage. And for example, they may not have gone to have their regular mammograms or the regular cervical smears. And therefore, if you present at a more advanced stage, you're likely to have a poorer survival rate. So again, really important if you're looking after patients with severe mental health disorder, really check and help them. Have they had their mammograms? Have they had their smears? Have they had colonoscopy or whatever else they need? And I just want to finish with this really interesting study looking at the association between physical exercise and mental health. And it was done in 1.2 million people in America. Cross-sectional study done over 4 years. And it was published in Lancet Psychiatry in 2018. And as I said, 1.2 million Americans, and they took data on their physical activity and their mood. And they divided them into an exercise group and a non-exercise group, matching them for socioeconomic factors. And very interestingly, the exercise group had 43% fewer poor mental health days in the previous month compared to the group that didn't exercise. So that was 35 versus 18 days of feeling less well from a mental health perspective per year. So that's quite extraordinary. And the largest associations were with people who exercise 3 to 5 times a week and 45 minutes duration. So we're not talking about huge amounts of exercise per week, 3 times 45 minutes. And interestingly, people who are doing team sports and cycling. So it may be that actually, seeing other people and being part of a team, not surprisingly, maybe has a positive effect as well. But this was the fact at the end of this paper that I really liked, because it said people who are physically active feel just as good as those who don't do sports, but who earn about $25,000 more a year. So just think about that. If you become physically active, you're going to feel as good as if somebody gave you a present of a salary increase of $25,000 more a year. So I'm going to leave you to think on that one. That's the end of lesson 4. I'll see you soon. Bye now.